My name is Rachel Engel, and this is my informative speech on type 2 diabetes. Type 2 diabetes is a condition in which the human body takes its most important fuel source, glucose, and metabolizes it incorrectly. When the body is affected by type 2 diabetes, it resists the effects of insulin or fails to produce sufficient amounts of insulin for the body. Type 2 diabetes is most common in adults, but is becoming more and more prevalent in younger children because of child obesity. There is no cure for type 2 diabetes, but there are many ways a person can manage this chronic condition by exercising and eating well. There is evidence to suggest that weight loss surgery would be more beneficial than dieting and exercising. In a study led by Anita Corcolis, the head of general surgery at University of Pittsburgh School of Medicine, 61 diabetic adults suffering from obesity were assigned either a surgical procedure or a diet and exercise program. Over the next 3 years, 69% of those adults who received surgery were in remission from type 2 diabetes. But the adults on a diet and exercise regimen saw no changes at all in their condition. Type 2 diabetes occurs when the pancreas fails to make adequate amounts of insulin for the body, and even the insulin that is being produced cannot be used effectively. This is a condition known as insulin resistance. The buildup of sugar in the blood harms the body's kidneys, eyes, nerves, and heart. Frequent urination, fatigue, extreme thirst, and numbness of the extremities are all symptoms of type 2 diabetes. This disease is associated with poor diets and lack of exercise. Simple lifestyle changes have the power to help get rid of this nasty, life-changing disease. Diabetes has been around for a very long time. The earliest known record of diabetes dates all the way back to 1552 BC, when a physician stated that constant urination was one of his symptoms. The first chemical tests were developed in the early 1800s by many scientists working together. These tests calculated the amount of sugar in the urine. In the late 1800s, the life expectancy for diabetic children was only 1 year, and the life expectancy of a 30-year-old diagnosed with diabetes was about 4 years. In 1921, insulin was discovered by a Roman scientist. It was first tested on a dog and was found to be very successful. For the rest of the century, insulin was refined and improved significantly. Many new technologies were introduced, such as blood sugar monitors, insulin pumps, insulin analogs, and insulin pen delivery systems. The many different types of insulin allowed doctors to customize insulin treatments for each patient and reduce the side effects of diabetes. The formal names for type 1 and type 2 diabetes were introduced in 2003. In 2014, studies showed that 26 million people living in America had type 2 diabetes, but only 1 in 3 of them were aware of it. Insulin is a hormone in the body produced by the pancreas. Insulin is necessary because it moves blood sugar into the cells. The sugar is stored in the cells and is used later on for energy. In type 2 diabetes, the body's fat, liver, and muscle cells do not respond to the insulin the way they should, called insulin resistance. Therefore, this blood sugar cannot be stored and used later for energy. Hyperglycemia occurs when there is a large buildup of sugar in the blood. Most people who are diagnosed with type 2 diabetes are overweight. This increase in fat makes it very difficult for the body to put insulin to work in the body. Found in Brent Weiss's New York Times article, type 2 diabetes can also develop in people who are not overweight or obese, but this usually just occurs in elderly people. Type 2 diabetes is a genetic disease, and most people who are born with the disease are born with the genes for insulin resistance. The pancreas in patients with type 2 diabetes gets tired and wears out much faster than any other person because it is making so much extra insulin for the body. According to the book Diabetes for Dummies, written by Alan Rubin, the pancreas is unable to keep up with the human body, and this person will be diagnosed with prediabetes and then diabetes. A person diagnosed with diabetes should immediately create a treatment plan that includes a lifestyle change, physical condition, and a work schedule. Managing diabetes is something that all diabetics have to learn how to do. Creating a treatment plan will make things much easier to handle. Physical activity and healthy eating are two of the most effective ways to treat type 2 diabetes. Sometimes exercise doesn't work for some people, so they must resort to taking medications to help lower blood sugar levels. If oral medications don't work to treat diabetes, insulin must be injected under the skin. The history, theories, causes, and treatments for type 2 diabetes are a very overwhelming thing to think about. Type 2 diabetes is a very common disease and has affected billions of people in the world. This disease would be very difficult to live with, and it would require an enormous amount of care and attention to be treated properly. It is a very unfortunate thing